explaining benefits of a premium lens targeting the patient or the attendant. So I would like Dr. Meenu Mathan here to first take this question. Targeting the attendant or the patient, always a dilemma, sir, because half the time the patient is there and then later, 5 minutes later, he brings the attendant and you have to tell the entire thing again to the attendant. So how do you deal with that, especially in a busy OPD?
All my cataract patients, they come inside with whoever has come with them. That is the first thing. And they go to the refraction cubicle also along with their one senior attendant. So they will see how much the patient is seeing on refraction. So first question to be answered is whether you're seeing or not, whether you have a difficulty in seeing. If they tell that, then only I start talking about surgery. And I have a TV monitor connection to with the camera to the slit lamp, and whatever is there in the patient's eye is I show it to all the bystanders. And I have another monitor where the LOCS classification of cataracts is placed. And I tell them, you compare the lens of your patient with what is there on my on the international classification. So if you think that this cataract is there, I think that this cataract is this grade, I will show them that this is this grade, and her vision problem is connected to that. Then you should think for cataract surgery if you want to get the vision corrected as soon as possible. And most of the things, many a time the attendant speaks, because most of my kind of patients, more than 50% are relatively older people with their children bringing them, and or there will be a couple coming in with all their children outside. Kerala has a peculiar thing that many of their children are abroad in the Gulf or in the US or UK and all, and they will come with today also. One old man and a lady came, and he connected the phone to his son, who is a cardiac surgeon in Punjab. So Malayali people, Kerala people, but they're working there. So he wanted me to tell to him. Actually, I had explained everything to them, but he wanted the gist to be told to him also. So that we have to address. So you don't know who pays, you don't know who takes care of them. So that has to be discussed with them initially when they come in, and then we would give equal importance or even more to the attendant also, so that later on they don't come with problems. They will come later on if somebody is not explained. A new attendant will come next time and say that she says she's not seeing at home. Can you just check? So then you ask him, what are you not seeing? Okay, you have not given him glasses yet. So you have to tell them that you have not given him glasses yet. And so we may have to explain to new attendants who come up during future visits, post-op visits. That is another new thing which will happen. But that we have to cannot help it. But before surgery, I make sure all of them, most of them who are concerned come. Or at least on the preoperative workup day, I ask them to bring their the concerned person who is either paying or who is putting drops or with them during the post-op period.
Right. So I think first pearl we've got from our opening statement itself, displaying and putting the LOCS classification and showing them that these are the international guidelines. Now you can see this is the cataract of your patient and this is what grade it falls in. I don't think a lot of us do it, but yeah, I think that's a great pearl to have it on display. So Dr. Sudeep, your take on this as a youngster. How do you take the attendant, or how do you identify? Because I've heard this from a lot of senior ophthalmologists. Always identify the decision maker. When you're counseling, always identify who the decision maker is and you channelize your energy on that person, because that decision maker will only influence what the patient will do ultimately. So what's your take?
In my premium IOL practice, I usually counsel the patient myself as of now. Usually my counselor is standing next to me, but I still make it a point to counsel the patient. I show them the biometry, I show them the benefits of a trifocal lens, and usually I counsel both the attendant and the patient. I show them a slit lamp picture of their cataract, and I show them some slides which I have from the internet, some genuine slides from the internet, which show a trifocal vision of the patient. So these, again, it's all evidence-based medicine in my practice now. I mean, you have to walk the talk. So if a patient knows what he's getting, and as the golden rule of trifocals is, chair time is very, very, very important. I tell them that I'm not guaranteeing you complete independence of near vision, but yes, it will only be 5% of your daily pickup rate as of now. So I think I counsel both of them. I hope most people have enough space in their OPDs where you can counsel your attendant and the requisite patient. And especially in younger patients also, I had recently had a golfer from Australia. He said that I want to remove my spectacles. I have a -4. He was a 50-year-old male. He said, I'm really passionate about golf. So I have a problem wearing spectacles while I'm playing golf. So, you tend to get such peculiar cases also. People who are highly driven to remove glasses are not really good candidates for Presbyond also. So, I think the key is chair time. I think the key is being patient. I think the key is being genuine with your patient. Do not overpromise. Do not look at the total package cost and start feeling good about yourself. There are a lot of costs involved in that. So I think these are the small, little practical tips that I use in my day-to-day practice.